Diabetes is a widespread chronic condition that affects millions of people globally, often leading to complications that extend beyond blood sugar control. One such complication is carpal tunnel syndrome, CTS, a condition where the median nerve in the wrist is compressed, causing pain, numbness, and weakness in the hand. Research has established a strong link between diabetes and carpal tunnel syndrome, showing that diabetics are significantly more likely to develop this condition. We will talk about how diabetes causes carpal tunnel syndrome, underlying mechanisms, and management strategies. Diabetes markedly elevates the risk of developing carpal tunnel syndrome. A comprehensive 2022 meta-analysis of 42 studies involving over 3 million participants found that individuals with diabetes are nearly twice as likely to develop carpal tunnel syndrome compared to those without the condition. This risk is particularly pronounced in diabetics with neuropathy, a nerve damage complication caused by prolonged high blood sugar, where the likelihood of carpal tunnel syndrome increases even further. While a small minority of studies, such as a 2014 case control study, have questioned this association by suggesting other factors like obesity might contribute, the overwhelming body of evidence, including large cohort studies, confirms diabetes as a significant risk factor, especially as the duration of diabetes lengthens. The prevalence of carpal tunnel syndrome paints a stark picture of its connection to diabetes. In the general population, carpal tunnel syndrome affects approximately 3% of individuals. Among diabetics, this figure rises to 14% overall. For those with diabetic polyneuropathy, DPN, the prevalence jumps to 30%. A 2018 to 2019 cohort study of 353 type 2 diabetes patients reported an even higher rate, with 39.3% experiencing carpal tunnel syndrome. Further evidence comes from a Korean study, 2002 to 2015, of 12,419 carpal tunnel syndrome patients, where 20% had diabetes and 14.9% of the diabetic cohort also had diabetic polyneuropathy. These numbers highlight the elevated risk for diabetics, particularly those with poorly managed blood sugar or long-standing disease, emphasizing the need for heightened awareness and early intervention. Diabetes contributes to carpal tunnel syndrome through specific biological mechanisms tied to high blood sugar levels. Nerve damage, diabetic neuropathy. Elevated glucose over time damages nerves, a condition known as diabetic neuropathy. This weakens a median nerve, making it more prone to compression within the carpal tunnel, the narrow wrist passageway. Tendon inflammation and stiffening. Excess glucose in the blood triggers inflammation and hardening of the tendons in the wrist. These stiffened tendons encroach on the carpal tunnel, squeezing the median nerve and triggering carpal tunnel syndrome symptoms. These processes not only increase the likelihood of carpal tunnel syndrome, but also amplify its severity. Studies show that diabetics with carpal tunnel syndrome often face worse symptoms and poorer surgical outcomes, particularly if blood sugar is uncontrolled. Diabetics have a higher risk of postoperative infections. Additionally, the longer a person has diabetes, the more severe the nerve injury becomes. Effectively managing carpal tunnel syndrome in diabetics involves addressing both the underlying diabetes and the nerve compression itself. Key strategies include glycemic control. Maintaining stable blood sugar levels can reduce the risk and severity of carpal tunnel syndrome. Research suggests that better glycemic control improves nerve function, potentially slowing carpal tunnel syndrome progression. Notably, lower HbA1c levels before surgery are linked to improved outcomes, underscoring the importance of this step. Surgical intervention. Carpal tunnel release surgery can be highly effective for diabetics, yielding outcomes comparable to non-diabetics when diabetes is well managed. However, accurate diagnosis is critical, as diabetic neuropathy can mimic carpal tunnel syndrome symptoms, necessitating electrophysiological studies to distinguish between them. Postoperative care. The American Academy of Orthopedic Surgeons recommends NSAIDs and acetaminophen for post-surgery pain and advises against routine splinting unless specifically needed. Local anesthesia alone may suffice for procedure. Interestingly, carpal tunnel syndrome surgery may also flag undiagnosed diabetes, as some patients are later diagnosed with a condition. Suggesting early carpal tunnel syndrome intervention could double as a diabetes screening opportunity. These strategies highlight the importance of a proactive, integrated approach to managing carpal tunnel syndrome in diabetics. Diabetes significantly increases the risk of carpal tunnel syndrome by damaging nerves and altering wrist tissues through high blood sugar levels, with a prevalence of up to 30% in diabetics with neuropathy, compared to just 3% in the general population. This connection is both striking and concerning. The mechanisms, including nerve damage and tendon stiffening, explain why diabetics are so susceptible, while effective management through glycemic control and surgery offers hope for relief. Given the overlap with diabetic neuropathy, careful diagnosis is essential. Diabetics should stay vigilant for carpal tunnel syndrome symptoms and collaborate with healthcare providers to address both conditions, ensuring better hand health and overall well-being. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.